My name is Katja Weisel. I'm an associate professor at the University Hospital of Tübingen, Germany. I'm here at the ASCO meeting, presented the MMO3 trial, the updated survival analysis of pomalidomide in combination with low-dose dexamethasone in patients with relapsed and refractory multiple myeloma. We know that myeloma patients with relapsed and refractory disease have a poor prognosis if they have exhausted the treatments with the novel drugs like bortezomib and lenalidomide. And we have with Pom+LoDex, the third immunomodulatory drug after thalidomide and lenalidomide, which is active in relapsed and refractory multiple myeloma. And this was shown in various phase 1 and 2 trials. The drug was recently approved by the FDA in the indication of refractory disease after treatment with bortezomib and lenalidomide. The MMO3 trial is a clinical phase 3 trial, the first clinical phase 3 trial where pomalidomide in combination with low-dose dexamethasone was compared to single-agent high-dose dexamethasone in patients with advanced relapsed and refractory multiple myeloma. So these patients who were included into the trial had to be refractory to their last prior treatment line, had to have more than 2 prior treatment lines, and had all failed previous treatment with lenalidomide and bortezomib. There was a 2-to-1 randomization. The trial included 455 patients, 302 received pomalidomide in combination with low-dose dexamethasone in the well-known treatment schedule, and 153 patients received the high-dose dexamethasone in this patient group. The main toxicity we saw under pomalidomide in combination with low-dose dexamethasone was hematologic, with a rate of severe grade 3 or 4 neutropenias of 48%. However, we had only a very few febrile complications in the setting. We saw that the drug was generally very well tolerated. We had no evidence for an increased incidence in thromboembolic events or peripheral sensoric neuropathy. The main grade 3-4 non-hematologic toxicity were infection in both arms with predominant pneumonias. From the data of the MMO3 trial, we conclude that pomalidomide in combination with low-dose dexamethasone as a new standard of care for patients with relapsed and refractory multiple myeloma disease after treatment with bortezomib and lenalidomide. It's a generally well-tolerated treatment in a heavily pretreated patient group. Further clinical trials will evaluate the drug in further and earlier indications, and we are looking forward to these results.